Do you have a neck issue? Maybe you have neck pain, stiffness, tightness, lack of range of motion or mobility. Maybe you have headaches or you have pinched nerve going down your arm, or you have dizziness. Have you been told that you have a loss of cervical curve or military neck? Or maybe even worse, you've been told you have a cervical kyphosis where the neck is reversed from its normal configuration. If any of this applies to you, stay tuned because I have a great video to help you. In this video, I'm going to show you how to fix your neck posture or alignment with a few easy exercises that you can do at home. My name is Dr. Jon Saunders, and I've been treating patients for over 21 years with spine-related conditions. One thing I've learned over 21 years is if a patient wants the fastest results to pain-free and getting back to the life that they want to live, they need to do their part at home. I'm going to show you a couple exercises that you can do if you have a flat neck, a military neck, or even a reversed curve or cervical kyphosis. That being said, the best way to get the most efficient and specific help for your case would be to seek out your local corrective chiropractor. So I strongly suggest you do. For those that don't have access to that, this video will be the next best thing. Let's get to it. I'm going to show you 5 different exercises in this video where we're going to break it into 2 parts. The first part will be for those that have some loss of neck curve and forward head posture. Those first 2 exercises I'm going to show you right now are for this configuration. So if you have an x-ray report or you have x-rays, find out if this is your neck configuration because these 2 exercises are for you. The first exercise we're going to do to help with forward head posture and a loss of cervical lordosis would be what I call the chin tuck 2.0. I want you to stay tuned because I am going to show you where you shouldn't do a chin tuck, which is detrimental to your neck and can cause worse issues. But if you have a forward head posture with some curve still in your neck, 2.0 is this. Instead of coming straight back, we're simply going to pull our shoulder blades back, look up slightly or extend your neck, and then pull your head down on a 45-degree angle. And hold for 3 seconds. And then relax. Up, pull, and hold. You can hold this for up to 10 seconds. You should be engaging your rhomboids, your lower traps, extensors, and neck retractors or deep cervical flexors to hold this position for 10 seconds. You can do this 2 to 3 sets for 5 to 10 repetitions. The next exercise I'm going to show you, we're going to get on the floor, so follow me. For this one, we call the prone neck lift. We're prone on our stomachs, we're on our elbows, we're going to hang our head slightly like this, and all we're going to do is come up and hold for 2 to 3 seconds and come down. What you want to do is visualize your head coming back over top of your shoulders and you creating that nice smooth arc or natural lordosis in your neck. For some of you, if you have low back pain when you're doing this, you can put a pillow underneath your pelvis just to provide some support. This exercise can be done for 2 to 3 sets for 10 repetitions. You know you're going to be doing it properly because you're going to feel the neck muscles, the traps, and your rhomboids even firing to help support the movement, mobility, and the natural curve. For the next part, we're going to talk about those who have a military neck or a reverse curve, which is called the cervical kyphosis. That is where the neck has lost all of its curve and it's either straight or it's reversed and actually gone the wrong direction. This can be a very painful syndrome for some because what it does, it really irritates the nerves. It puts a lot of pressure on the discs. So it's really important you try to increase that curve, increase mobility, and strengthen the spine to keep you feeling your best. One thing you should never do if you have a military neck or a cervical kyphosis is straight chin tucks. I see them recommended all the time, but if you can visualize, if your neck is straight or kyphotic and you tuck your chin, you're actually creating a reverse curve and you're solidifying something we're trying to change. So never do chin tucks if you have a straight neck, military neck, a flat neck, or a cervical kyphosis. If you take anything from this video, that's probably the most important point. Okay, for the first exercise, you are going to need something at home. It could be a towel, you could use a band, a TheraBand, anything you have that's going to create a pivot point on your neck. This is called a Prol lordotic stretch or exercise. Basically what you're going to do is take a TheraBand, something that you can put in the middle part of your neck and create a little bit of tension. So we're creating a pivot point for your neck to bend over. And so simply what we're going to do is pull this out, extend our head slightly up, and then we're going to extend our head and hold for 2 to 3 seconds and come down. So you're retracting and extending at the same time. Even though this might look easy, as you get up in your reps, 10 to 15 reps of this for 3 sets, you will start to feel the muscles doing what they're supposed to do. Again, with all of these exercises, I really want you to visualize what your neck, or what you're attempting to do with your neck. And in this case, it's to create that natural lordosis. So you really want to visualize, you're trying to really pump, create mobility, and create some of that curve in that neck. Or in your neck, I should say. Do this for 3 sets, 10 to 15 reps, and you'll be on your way to helping increase your mobility and alignment in your neck. 2 more exercises to go. Stick with me because these 2 are very important. This next exercise is called the flip exercise. It's designed to help correct a cervical kyphosis, and the name comes from the doctor that designed this exercise. Basically what we want to do is we want to stand up, we want to hold our shoulder blades back together, we want to protrude our head, extend our head, retract on an angle, and then chin tuck. Hold for 5 to 10 seconds. Protract, extend, retract, and tuck. Show that from the front. It does take a little bit of getting used to. It takes some practice. Don't push fully into each position when you first start it, because sometimes it can cause a little bit of discomfort or dizziness in some patients. Take your time with it. Just slowly come out, extend, pull back, and pull in very gently. If you find you can't do those movements, click the video here. I have a quick neck mobility that can help increase your mobility to allow you to do some of these exercises. We're almost done. We got one more. It kind of wraps everything up because it's a really relaxing stretch. I know you're gonna like this one. We're back on the floor. Let me show you. The last exercise, we're gonna get back on the floor. We're gonna be using a product called a Denal. Now, I know most people don't have a Denal at home unless you're under the care of a corrective chiropractor. The next best thing for you would be a pool noodle, a rolled towel, something that's gonna create a pivot point to create that curve around your neck. Now, this is definitely not anywhere near as effective as this because this is measured to the patient specifically. There's different sizes. There's different positions that is required based on what your x-ray configuration shows. This is where it would be beneficial for you to seek the care of a corrective chiropractor so you make sure you get the best results in the shortest amount of time. But if you're at home, the pool noodle will be the next best thing. So get in a comfortable position. Put this more towards the base of your neck if you're using a pool noodle or a towel to help really extend the head over. And you're just gonna lie. You're gonna relax anywhere between a minute, but you should push up to more minutes. Up to 10 to 15 minutes would be ideal. It's calming, it's relaxing, you breathe normally, and it's a good cool down to the exercise that we just went through. The difference between this and this is more specific and probably more effective. And you can feel that significantly more in terms of what it's doing. If you have a postural issue, I encourage you to stick around, check out my channel. There's probably a video that's going to be perfect for you to help yourself correct your posture at home. If you like videos just like this, maybe you'll show some support by giving me a thumbs up. If you're new to my channel and you like the content I'm putting out, you might consider subscribing as well. If you have an idea for a video, please put it in the comments below. This is where I get my ideas from viewers like you. I'll want to help you in the comfort of your home. So put your idea in the comment and I'll be sure to add it to my list so I can make that video for you. I appreciate you tuning in. I can't wait to see you in my next video. Until then, stay well.